So our next guest is Dr. Matt Sawyer, and he's going to be looking at the theme of why sustainability is good for public health. Welcome, Matt. So Dr. Matt Sawyer has worked as a GP for nearly 2 decades in the Northeast. He now runs an environmental sustainability consultancy, SSE Sustainability, which works to improve human and planetary health. He covers sustainability issues facing healthcare, including understanding carbon emissions footprint and helping to produce roadmaps and action plans to meet NHS's net zero ambition. He has an MSc in corporate sustainability and environmental management. He's worked with us several times before doing webinars. I've enjoyed them all. So welcome, Matt. Over to you.
Thank you very much. I'm not entirely sure how I can follow Mike and his presentation, but I will do my best. I think we've had some great, we've heard from some great speakers this morning around stats of current modes of travel and commuting, number of miles travelled from burning fossil fuels. But my take is really, what's the health impact of that current commute and current travel? And what could be the health prizes of changing that? Next slide, please. But I'm actually going to start with a rhetorical question. What are the problems that are being faced by people and companies? Are they financial, social, environmental? And actually, what could be a solution to these? So do we want to have a better health of our workforce? Reduce our company or business's greenhouse gas emissions? Reduce any harmful impact that we may be having on the environment through our activities? And actually, what about friends and family and the neighbourhoods and the communities in which we live? And how could we help staff with the cost of living that's only seems to be going up at the moment? Next slide, please. So from a health perspective, we know that burning fossil fuels, so transporting people and goods or the daily commute, really affects air quality through some of the pollutants that are produced. And there's a dual impact of travel from petrol and diesel vehicles. And it's not just air pollution, but it's also levels of physical activity or inactivity. So globally, there's about 9 million people who die prematurely from those two elements combined, from air pollution and physical inactivity. And just to try and put that into context, whenever I hear a figure, a number, 9 million sounds a lot. 9 million out of what? How many global deaths are there? Well, there's about 70 million or so. So suddenly we've got maybe 1 in 6, 1 in 7 deaths, 15% of global deaths are occurring prematurely because of poor air quality and physical inactivity. And just to put that into context, the population of the entire West Midlands is about 6 million. So this is a bit like everybody in the West Midlands, and then 50% more dying prematurely every year. Next slide, please. In the UK, what does that translate as? Well, there's about 38,000 or so deaths that's attributed to that long-term exposure to air pollution, and that's in the region of about 7% of UK deaths. Just thinking about other contributors to ill health and premature deaths, air pollution is the fourth largest contributor. The other 3 that are more impactful on our health is tobacco, diet, and high blood pressure. So air pollution is the 4th in terms of contributing to diseases. And diet, which we've just heard from Mike, particularly those which are high meat and high dairy diets, those that are low in fruit and veg, feed into other elements of the polycrisis and unsustainable food systems. So they're affecting global impact and our health. Next slide, please. What sort of health problems does poor air quality and air pollution contribute to? Well, we know that air pollution, particularly from traffic, can exacerbate respiratory conditions, so things affecting the lungs, such as asthma. And we know that there's links between roadside pollution, for example, and stunted lung growth in children. We know that cardiovascular health, so this is the heart attacks and the strokes, we know that air pollution can impact and cause heart disease and other related problems. In terms of mental health, we know that there's a link between air pollution, poor air quality, and mental health conditions. For example, it can contribute, or it does contribute, to dementia. So if there's anybody who's listening who are, for example, men in their 50s and 60s, the risk of dementia goes up. Actually, we should be worried about this. In terms of mortality, so that's the number of people that die. We know that air pollution is that significant environmental health risk, and I'll talk about a study a little bit later about how improving air quality can reduce the number of early deaths. And we know hospital admissions. So we know that, for example, hospital admissions from things like asthma increases during periods of high air pollution, poor air quality, and goes down when air quality gets better. So actually, this is not just a single impact, but we know that this can affect and contribute to multiple different diseases and health conditions. Next slide, please. We've heard from some of the speakers already that car use is likely to continue and at high volumes. But what's the comparative impact of different vehicle types? So, for example, if a mile is travelled in an electric car and that causes 1 unit of health damage, so actually a petrol car causes 5 times as much. But diesel vehicles are actually 20 times more impactful in terms of harming our health. And that's me and you, of course. That's our friends, our family, our neighbourhoods, and the wider society. Next slide, please. And there's also a financial impact of that. We know that there's a cost associated with treating and managing and looking after all of these patients with all of these different conditions. And actually, diesel vehicles account for about 90% of that health spend. So actually, this is affecting what we pay in our taxes, how much we need to spend on the health service. Next slide, please. But there's other impacts from vehicle travel, and companies and businesses who are interested in reducing their greenhouse gas emissions, their carbon emissions from travel. Well, actually, domestic travel contributes nearly 30% of UK greenhouse gas emissions. But I'm particularly interested in what that does for air quality. So air pollution is formed by a variety of different gases and different particles, which are usually released from the burning of fossil fuels, particularly from a transport perspective. And transport is responsible for about 50% of the nitrous oxide emissions and nearly a quarter of the small particles that we end up breathing in. Next slide, please. So what impact could changing the mode of travel and commute have on UK greenhouse gas emissions? So this is taken from the Committee on Climate Change, and they have a travel section, and it really shows the impact of different actions that we as individuals or as companies or as businesses or as a society can take. Part of it is a shift from burning fossil fuels, so petrol and diesel cars and vehicles, to electric ones. That's the orangey and the purpley colours lower down on this chart, and also things like moving freight from road onto rail. But it really highlights and demonstrates that 7% of the reduction in greenhouse gas emissions from transport can come from changing how people travel and the amount and volume of people who are on public transport or travelling more actively, having a more active commute. Next slide, please. But what other impacts does using cars have on our health? Well, it's common sense, really, that car impact affects us in terms of physical activity. We know that car ownership is linked to how much walking and cycling people do. If you have a car, you're less likely to walk. Children who live in households without an access to a vehicle are 2.5 times more likely to walk to school than children who have got car access. Car use is associated with obesity, but walking and public transport are associated with being less overweight or less obese. Next slide, please. So actually, it is almost whatever problem we have: air pollution, physical inactivity, premature death, climate change, health costs. There is a solution to all of these, and that is more active travel and more active commutes. Next slide, please. So actually, there's a whole host of things that we can do as individuals. And I think some of this has come up in some of the questions about our travel identities. I am a car driver, I am a cyclist. Well, actually, it's overcoming that and saying that we can be multimodal commute. So sometimes we might drive and walk. We might get the bus and cycle. We might use more than one mode of transport when we commute. So how can we make sure that we do take the most active options where possible and where appropriate? How can we add physical activity into all of our commutes? Each time we commute, we do a bit of walking or a bit of cycling or something that is more active than just sitting. I've already mentioned that the diesel vehicles are particularly problematical. How can we avoid buying a diesel? Can we replace a diesel when it dies with something that is less polluting? How can we make sure that when we're parked up in a car, we don't have the engine running? And how can we make sure that we demonstrate our willingness to share that journey, to commute with somebody else? When was the last time you travelled on your commute to work with somebody else in the car other than a family member? Next slide, please. In terms of the workplace, having and implementing active travel policies, having an active policy that is implemented to not have diesels in the workplace, to not have idling, to enable the alternatives, whether it be car sharing, electric vehicles, or as a business, as a community, so as an organisation, preparing for and supporting clean air zones. Next slide, please. And as a community, we have got a voice as well. So whether it's speaking to the councils, having our say in surveys, discussing with people in power, responding to articles in the media, we can put forward the health benefits for active travel, safer streets, where the services that we use are cited, and for better public transport. Next slide, please. Clean air zones can be really effective in improving air quality and the health of the community. So in Bradford, for example, 25% less people had heart and lung problems when the clean air zone was introduced. In London, around 30% reduction in some of the pollutants, the nitrous dioxide and the small particles. Less people needing healthcare is great for me and you, so that we've got less people in the queue, less people needing to be seen because they didn't become ill in the first place. Next slide, please. In Oxford, for example, studies were done showing that there was a fall in the number of people who ended up going into hospital as air quality got better. Next slide, please. There's a benefit to the staff that we work with, our colleagues in the workplace. Those who walk or cycle have a lower risk of mental or physical ill health, less admissions to hospital. And actually, if a company wants to improve its productivity, then perhaps enabling people to have a more active commute can help achieve this, as 60% of people said that when they commute actively, they are more productive in the workplace. Next slide, please. Next slide, please. So to summarise, zero carbon and active commutes have got multiple benefits. When we start identifying and recognising these benefits, we can really see that selling of the, in inverted commas, of active commuting becomes far easier. This is not just about reducing emissions, but it's all of those additional benefits that are really, really important. Thank you very much. Check me out on LinkedIn and I will see you at the Q&A.
Yeah, Matt, thank you very much. Please do get your questions on for Matt. He will join us again in about 30 minutes for